Fair, accurate, to the point. This is Face the State on Montana's news station.
I'm joined now by two employees of the Center for Mental Health. We have Heidi Gibson. She is the executive director of the Foundation for the Center for Mental Health, and Trent Lear, the clinical director for the Center for Mental Health. Thank you both for being here with us. For May, we're talking about mental illness. We're talking about Mental Illness Month, and we're talking about mental illness all throughout the month of May, and trying to keep that conversation going throughout the whole year. So Trent, I want to start with you. Let's talk very basically, what is mental illness?
Well, it really depends on how it presents itself. When you start talking about mental health and mental illness, it's not like a light switch. So it's not one day you are and one day you aren't. Things develop gradually, and family members become concerned about that because mental illness does not play favorites, nor does it decide to pick on any individual. That's not the way that works. If people are seeing changes in their loved one, they need to be aware of what some of those are and when maybe you should ask for help from a professional. If you start seeing things like a marked personality change, if they're having difficulty coping with what normally was very easy for them, if you're seeing all of a sudden excessive worry, people were gregarious, they were outgoing, and all of a sudden they're very reclusive, perhaps even clothing styles change, you see those alterations. You may also see or hear about, I don't feel right. Some people will actually talk about, I'm thinking about harming myself. And those are things to be taken seriously. It makes people uncomfortable because most of the time we don't like to think about things like that. But in Montana in particular, we need to. Because the incidence that we have is very high in this state, and for at least the last 5 years, we've ranked within the top 3 in the nation in a statistic you don't really want to have, which is successfully completed suicides. So when you're looking at that, also look, and this is concomitant with the issue in Montana, our rates of drug abuse and alcoholism. And that also couples with domestic violence in our state. So if you're seeing changes, somebody is not acting right, they're drinking more, you may want to start looking at what is the impact in the life, and maybe you need to approach that person, because a lot of us, if we see someone and it's kind of unusual, Montanans are pretty good at minding their own business and not getting into other people's stuff. But this may be a time where you actually want to ask the question and not be afraid of the answer. Right. Because if someone actually says, yes, I think I am having a problem, there are a lot of opportunities to get help in the state. They're not as broad as we would like them to be. And there are issues in terms of, well, myself, I've been in this field for almost 30 years now, and the literal graying of the workforce is an issue that's going to have to be addressed.
And we'll talk about that a little bit more. Let's talk about, I really want to talk about this whole Montana idea. There's a stigma surrounding mental health in general, but especially around Montana. You yourself said that people think they're tough enough, and that there's this difference between will and desire. They think it's a will and desire thing versus it being a physical thing. You said that we'll go to the doctor. We're not afraid to go to the doctor if we have a broken leg. Of course you would go to the doctor. You're not afraid to go to the doctor if you have a sniffle. You're not even afraid to call the plumber if you have a problem with whatever is going on in your bathroom. But if you're having problems psychologically, there's a little bit of a tougher step getting there.
And I think that's because the state of the art in the industry is slow to actually come into general awareness. It's becoming more prevalent where people are now understanding how the brain and the body interact and what actual mental illness means in terms of brain structure and function. There's a lot of this work that has come because of a lot of our returning veterans from the Gulf War. One of those issues is traumatic brain injury. The other is when you are in circumstances that are beyond the pale, where you have to deal with chronic stress and there is no relief for it and you don't see a way out, it actually changes the physical structures of your brain. And not to bore a bunch of people, but when you start talking about brain structures, there's the amygdala and the hippocampus, which are primarily involved in many of the issues that you see in terms of depression, anxiety, post-traumatic stress disorder, which gets a lot of airtime now. And through the research that is being done, there's an actual identified physical manifestation of that in the brain. And the studies and the research have shown that with effective treatment, and there are many that are best practices and clinically based best evidence practices, that you can track the changes in a return to being healthy by those changes in the structures in the brain.
Okay. Heidi, let's go to you. I want to talk about, once we get around to, we're establishing this as a physical thing, and once we get around to admitting that and to seeking out help, that there's something different though with mental illness when you are diagnosed with a different physical illness, that people kind of come out of the woodwork to help and support you, but generally speaking that has not been the case for mental illness.
A lot of times people, when they are waiting to be diagnosed or they're first diagnosed, it's pretty overwhelming and they feel very, very alone, and isolation is the biggest enemy for mental illness. And we had a volunteer who once said that mental illness is the only diagnosis that you will get that your neighbor won't come over with a covered dish. I think that's a pretty powerful statement.
All right, so I ask both of you then at this point, are we getting to a point, can we ever get to a point where your neighbor would show up with a covered dish when there is a mental illness diagnosis?
I actually believe that in terms of the changes of the stigma of mental illness, we can go back in time and talk about when people were put into sanitariums, and if you study the mental health history of other countries where they were chained to large car parts to control them, to where we are now through the deinstitutionalization movement that occurred in the 60s in America, to where now the actual discussion is active in our culture. That to me tells that over time people would become used to discussing it, much the way cancer used to be something you would whisper about and you didn't really want anyone to know because it might be catching. In that same vein, I believe talking about being mentally healthy and well will develop into that discussion, because it does have impacts on us in every aspect of our lives, as all other physical illnesses can have. But they are also able to be effectively treated if caught early for many, and then if you actually receive appropriate care.
Right. And Heidi has talked about, we have shared discussion about if you wait too long, if that isolation sets in, if you're trying to let your will and desire take over, that the rest of your life can fall apart. And by the time a lot of people come to you at the Center for Mental Health, we've seen a lot of kind of pieces of their life fall through.
That's very true. People often wait until they're really in a mental health crisis before they seek help. And it's kind of like if they wait long enough, it will go away. They can wish it away. But the truth is that with mental illness, the statistics are 1 in 4 people will be diagnosed with a mental disorder in their lifetime. So when we look in a family of 5, 1 of them will be diagnosed or should be diagnosed. For serious mental illness like schizophrenia, bipolar disorder, major depression, and PTSD, the statistics are 1 in 17. So it's very common. It's more common than heart disease, cancer, diabetes combined. So when we're talking about coming out into the open, it's really important for people to have that discussion. And one of our clients said, just because I'm not in a cast doesn't mean I'm not broken. So the theme for this year's Mental Health Month is Healing Trauma's Invisible Wounds. And there's very much so a very serious disorder called post-traumatic stress disorder. And we want to make sure that people know that it's real, that it's not made up. And one of the favorite things that someone told me once is, normal is a setting on a dryer.
There's really no gauge. And I think that opens up a good conversation as far as the spectrum, the wide variety of mental health. I think that many people have the idea that mental illness is just one thing, that we put those people in one corner. But it's really quite the wide spectrum of, we've talked about a number of different kinds of mental illnesses, and within that, the severity of each of them.
Yes. And of course the presentation is always very individualized. So when you're talking about what is mental wellness as opposed to mental illness, you start talking about what are the limitations of activities of daily life that are created because of what is happening within your brain. when you start talking about that with folks, a lot of people believe, again, we get back to a moralistic point of view, which is there's something wrong with you, as opposed to, no, actually, you're fine. There's something in terms of your physical health and well-being that needs to be addressed. And as all of us get older, everybody starts having that discussion around a cup of coffee about what's my current ailment and what am I doing about it. It was a joke I just heard when I was out for coffee with some of my friends. We've moved into that arena, which is really kind of sad, but it is normal. That discussion, and what's nice about that, when you have friends who are therapists, you also end up with a discussion of, how are you doing? What are you doing to take care of yourself? How are you feeling? Are you addressing the actual benchmarks in terms of growth and development? We don't use those words, I'm using them here, but it's that discussion. And it's normalized in that group, which I think then means it needs to be normalized for everyone else, because it is not something to be hidden. I mean, one of the best research that I've read actually says that in terms of depression, because depression and anxiety are two of the biggest diagnoses, at least in my professional career, and according to the literature of what you see that people tend to struggle with, those are very addressed easily through, not easily, pardon me, they can be addressed through medication and therapy. And that gives you your best hope of having a very quick resolution instead of having something that is drawn out for years in some cases through not seeking appropriate care or following, because most of us go to the doctor and we hear that we should probably pay attention to diet and exercise. Right? There's also things that you need to pay attention to in terms of your mental health, in terms of your functioning, because there's a gradation or a spectrum from where I'm just kind of down to when you become clinically depressed. And they're not the same thing. When you're down, there's a lot you can do to bring yourself back up, and they're effective. Those things work. When you move into depression, it becomes almost an absence of the ability to feel joy. And I've had people talk to me about that, where the world turns gray. You know, and you study some history with Winston Churchill, who talked about the black dog of depression that would come on him during his lifetime. And then that is sort of when you need to get professional help, because you won't be able to find your way out of there yourself.
Let's talk about that. So you talk about therapy, we talk about medication, we talk about different kinds of therapy, speaking with a therapist, but actually seeking help, I think getting to that point, huge step. But figuring out exactly what that means is another scary step. You and I have talked about some of the downfalls of medication and that not being a perfect system. Can you talk about that a little bit too?
Of course. What we see actually in terms of pharmaceutical companies and what's being addressed, many times it comes down to what is marketable for them in terms of the research and development. So in terms of progress for medications for mental illness, it is not as advanced as it is for other forms of physical illness. I believe that also needs to be a focus that people address as well. Because what winds up in this is, last time I looked, there's somewhere between 16 and 20 different antidepressants that can be used for an individual. Some of that is because all of our neurochemistry is the same and different. Because we're all human beings, so we all have the same base physical chemistry, and then we're all different because of our genetics, our lifestyle, who we are, it all then varies. So when you go, you create a relationship with your mental health providers. Usually it involves a psychiatrist who is trained in the medications and in actually ruling out and minimizing side effects. And then you have your therapist who talks to you about the psychodynamic parts of your life and what's going on and provides guidance in that arena.
Okay. So we're talking about a number of different ways to get to the path of healing. And Heidi, you've talked about a few others beyond medication, beyond talk therapy. Let's talk about some of the other ways to go about that therapy.
Well, our Beautiful Minds Walk is coming up in June, and a few of the therapies that we've talked about are pet therapy, the fact that having a therapeutic companion that can actually be licensed as a pet therapy companion animal. We also have art therapy, and we have an art therapy exhibit that's exquisite and used the work of clients who worked with their therapist to be able to create something that people could see that's tangible, and they could actually poke their heads through it and envision themselves as an astronaut or a professional dancer or a cowboy or whatever it is they dreamed of being. We also have equine therapy, and that means being able to connect with a horse in a way that we're not able to connect with a therapist in traditional talk therapy. And all of these are surrounded by the recovery model, which is a national transformation. It's the largest transformation in mental health since the deinstitutionalization movement that Trent talked about. So with the new generation of psychotropic medications, people are getting better than ever. They're leading a quality of life that is better than ever. And what we really want people to hear today is that people can and do get better. And when we see people, we often see them on their worst day. When we first meet them in crisis, it's often their worst day. And in terms of suicide, 90% of people who attempt suicide had a treatable mental illness. And what they tell us is they didn't want to die, they just wanted the pain to stop. And we're here to give them hope. And at the end of the day, when we walk out of our jobs at the end of the day, lots of stuff happens, but we remember one thing, that we are there to give people hope. And that's what we all do in the mental health field.
So we have those who are in the mental health field, we have doctors, we have therapists who, when a client comes around and when someone comes around and says, yes, I need help, and is willing to take that step, we have a good relationship going on there, we have good progress being made, but then we have the piece of society, and we've already touched on that a little bit. But I think specifically, I interviewed one woman not too long ago, and she said, when I was diagnosed, I was making all this progress, and she said, my family just didn't believe me. They said, no, you don't really have that. This is not a real thing. How do we get the people who maybe aren't necessarily the patients to come around and to also be part of that road to recovery?
I think really telling people that mental illness is not a character flaw. And a lot of times family members who it isn't that they're uncaring, it's because they just don't have the education, they don't have the right tools to be able to help someone. And so it's really important that family members address this as a condition of the brain. It's the largest organ inside the human body, and it's very mysterious and it's very complex, but we're learning so much every day, and that mental illness is real, that it's not made up, and it's not a character flaw. So being there for that person and not treating them as though they are less than because they're having symptoms of mental illness, because most people are only sick for a very short time, that they're really in crisis for a short time. So when they get better, they're more of themselves, and we get our family member, our friend, or our coworker back when they get better, and that's what we look forward to. That's the hope, and that's part of recovery.
And I think also, if I can interject,
Yes.
You're talking about the reduction of fear of the unknown. I mean, when we talk about Montana and the rugged individualist, and you just go do that, and you find what you're going to do, and you charge headlong into it because you can take action. You can use some of those same premises with mental health, but you have to educate yourself to it, which is where we're talking. The more you know about it, the more action you can take in terms of that, so then that minimizes the fear. Because most of the time, if we're going to deny something, it's because we're afraid of it. I don't really want to look at it, because if I look at it, I might have to understand it, do something about it, and I don't have any experience with that.
Right. That's what we're doing today. We're having people looking at it. We're sitting down to a Sunday morning and saying, let's just have a candid conversation about it.
Exactly.
Let's look at it. Let's go back to the piece about the graying of your field, as you put it. Tell me what that means.
Well, I think everyone's pretty aware of what occurred in our society after World War II. It's called the baby boomer generation. So there's a huge bow wave of individuals who were working in the industries that we're talking about, and this is not unique to healthcare or to mental health, but it is probably more critical in terms of the fact that in my entire professional career, demand has outstripped supply. I worked for a long time out in eastern Montana where we needed qualified mental health professionals, and they were happy to have me, but I was one of 3 in eastern Montana. The mental health center had another 2. So we had 5 people to serve about 17 counties, and we had 1 psychiatrist. So when you start talking need in the field, it's huge. And then to recruit people into that field, because for myself, it has been challenging, it's been exciting. I've done things within this field that I never dreamed possible. And in terms of providing people tools and education that they need, because if that is something that you find is a calling, because oftentimes working in the mental health field, you have a calling to help other individuals, to lessen suffering, to be of assistance to humanity. Those things are what you derive. And the sad part about that is, as everyone starts to compete for a very limited population of workers, we're going to see chronic shortages in the mental health field, but the opportunities are immense for those young individuals who would want to come into the field. And I know Heidi's been instrumental here locally in the Great Falls area in terms of encouraging students and having them come and have some experience of what those careers are.
And how do we do that, Heidi? How does that conversation go with someone who's 15, 16, 20 years old?
Well, I've really found incredible inspiration from them. We have a job shadow program where they come in through the school district, and we do a career day where we talk to them about what it's like to work on the inside and really give voice to it, because many times people really don't think about mental health until they have a personal involvement either themselves personally, a family member, or someone that they love. So that's a day when they can talk about it when they're not in crisis. They're not necessarily worried about someone who's close to them, but they're there to help other people get through that. And many times we talk about what John F. Kennedy said, which was the word crisis in Chinese is composed of 2 characters. One is danger and the other is opportunity. And so what we talk to young people about and those who are young at heart is that it's really when the door closes, the window opens. And we're really there to lead people to where the window is open, because sometimes it isn't always apparent. And that's true in careers, that's true in families, that's true in coworkers, and so many other relationships that we have. So that's part of what we do, and it's really easy and fun to talk to young people about that experience.
Right. So we're having this conversation about that we're making great progress when it comes to mental health, mental wellness, that we're having great conversations with youngsters about the potential for the field. We're in a time where America is in desperate need of jobs. Why are we having so much trouble recruiting? Why are we having so much trouble getting professionals in the industry right now?
Well,
in the field?
I think actually what you see, societies have to decide the priority for what they're going to put their resources toward.
Right.
So it becomes a greater discussion in terms of immediately, I just went into the political realm with that statement. The thing is, I know that, but it is the care of our populace that actually makes our nation strong. So when we start talking about that, I think the emphasis becomes, how do we get people trained and educated? Because of course, for many of the jobs that we have, you can come in as a bachelor's level. We have positions for folks who are high school educated. But when you start getting up into the fields that have clinical import, then you start talking about master's degrees and doctorates. So you have a commitment of time and resources there that people have to make very strategically. And then it's, again, what is the mission of what you want to do during your professional career? And I think that's a much broader discussion in terms of our entire country for what are we going to emphasize going forward, and how do we then put the necessary resources to it. The President's New Freedom Commission that was done under President Bush, I think George W., had very good recommendations about how we move forward to treat and address the mental health of our nation, and it's still a guiding document now. So how do we encourage that? I think it comes into healthcare shortage designations. Montana has many of them, but I have a feeling our entire state could be designated as a shortage area in terms of our population and the number of professionals we have in this. That then allows for loan repayment, for forgiveness of the loans that you accrue, because of course education, as we're hearing in the news, is expensive. And it is one of your best bellwethers against the economic up and downs of any economy.
Politically, go ahead.
Excuse me, I want to throw in there that we are also in the throes of a national shortage of psychiatrists, which are medical doctors. So when we're talking about all the fields that are under the mental health field, that is the backbone of mental health. So we are busy recruiting psychiatrists, but also APRNs, which are psychiatric nurses who are also prescribers. Very important aspect to the mental health.
Okay, and politically, no matter which side of the aisle you're on, everyone is healthcare is a huge issue right now. Everyone wants to talk about bringing down the costs, and we've talked about the fact that by taking care of those who are mentally ill, those who want to be on the path to mental wellness, that could really drive down healthcare costs for our country.
Oh, I think it could have a significant impact in terms of primary care that we're talking about, because your mental health is directly related to your physical health, and it will manifest itself. Much of the training that I have had in different forms of therapy, you can actually identify problems in terms of physical function that are related to the traumatic issues that people have gone through, and then how that manifests itself and can actually become debilitating, which then we incur the health care cost of that, as opposed to actually addressing underlying cause and addressing it early and often and getting rid of the fear of that for people. And here in Montana now, everyone's really happy because we're having sunshine. You know, the impact of environment and health has been there as well, and we're talking about 6 months in this country where you better get used to reading books and staying inside. Well, that's not real conducive for a lot of folks to be happy and have sun in their face. And we see those changes through the seasonal adjustment as well. So I think the focus that you're giving is excellent on these issues. And the fact that it impacts every area of a person's life, including their ability to care for themselves physically, is the emphasis can't be overstated.
Okay. So if anything right now, take home, seek help early. It's not a character flaw. And there is a road to getting better. Heidi and Trent, thank you for being with us today.
Oh, you're very welcome.
Thanks for watching Face the State. This has been a presentation of Montana's news station. Fair, accurate, to the point.